All right. Well, good afternoon, or I guess I should say good morning, depending on where you find yourself today. And just wanted to say welcome to our virtual panel discussion on how the pandemic has changed the future of aging and how innovations in home health care really can improve the health outcomes for seniors. I am certainly honored today to be joined by a few of the industry's leading experts in home health care, who I'll introduce in a second. But just while everybody's signing in, there are a couple of housekeeping items that I wanted to make sure that I covered for our attendees. First, just a quick reminder, this is a live webinar and it is being recorded. I'm hoping that my dog doesn't help prove that. But secondly, just wanted to make sure that everyone knows we really do want to make this an interactive experience. So we certainly encourage you to submit questions for our panelists throughout today's discussion using Zoom's Q&A feature. And also just please feel free to introduce yourself and share comments in the chat box at the bottom of your screen. Again, we do want to make sure this is as interactive as possible. And anyone who does submit any questions, our team is going to be collecting those questions and we'll share as many as we have time for with the panelists at the end of the discussion. So that should be happening around 1:45 or 1:50 Eastern. All right, well, let's go ahead and get started. By way of introductions, I'm Nate Andrew. I'm director in RSM's risk consulting practice, and I'll be your moderator today. Just for those of you who aren't familiar with RSM is the largest audit, tax, and consulting firm in the U.S. focused on the middle market, and is a member of the global accounting network, RSM International. And healthcare is one of our focus industries. But more importantly, let's meet today's panel. So I am joined today by Jason Perry. Jason is the Chief Technology Officer at Mindgrub. Mindgrub is a full-service digital agency and software consultancy based in Baltimore, specializing in web and mobile development, user experience, interactive design, branding, and digital marketing. And Jason has over 20 years of experience as an engineer and consultant and is certainly no stranger to providing technical direction for healthcare organizations. And I'd also just like to thank Mindgrub and their team for organizing and hosting today's webinar. Next up is Cathy Hamel. Cathy is the president at Gilchrist, which is a nationally recognized nonprofit leader in serious illness and end-of-life care. And Cathy has over 25 years of executive experience in healthcare management and has overseen the development of numerous innovative programs and strategic partnerships. Third, we have my friend and colleague, Rick Kess. He's a healthcare partner and senior healthcare industry analyst at RSM. Rick has worked with organizations across the healthcare continuum and truly is a thought leader and frequent contributor to major healthcare publications on topics of economic, business, and technology trends in healthcare. And then finally today we have Kevin Heffner. Kevin is the president and CEO of Lifespan Network, the largest senior care provider association in the Mid-Atlantic, representing nearly 300 senior care providers in Maryland and DC. And Kevin really is bringing today a deep understanding of the intricacies of aging services and senior care. So Jason, Cathy, Rick, and Kevin, just wanted to say thank you for joining us. And thank you all to those of you in the audience. Really appreciate you joining us and looking forward to the conversations. So to kick off today's discussion, really wanted to get all of our panelists involved and kick off with a couple of rapid fire questions just so we can hear from each of our panelists. And for those of you in the audience, please feel free to chime in as well and share your thoughts in the chat. So let's go. First question. So if you could describe the past year for healthcare and the healthcare world in general in one word, what would you use? And Rick, I'm going to ask that we start with you.
Well, Nate, I knew this was coming, so I've been thinking about it all morning, and I think it's as simple as hard. I think the year was very, very hard as a healthcare provider. As an advisor to healthcare companies, I think it was hard for us to not have all the answers, whether it be related to CARES Act funding or PPP loans or, anything else that our clients were looking at us for advice on. We had some answers, but not all of them. So I would say it was hard. It was a hard year for everybody, and whether it's business-wise, professional-wise, or what have you, it was a very hard year. So that would be my answer. Sorry to take the easy one from everybody else.
Well said, and probably an understatement. Maybe Kevin, if you want to share your one word next.
Well, I know we've all heard this word frequently during the course of the past year, but the word that we've been using probably more than almost any other is pivot. As many of you, we had to pivot our operations very quickly and very dramatically beginning in March and April of last year. Traditionally, as you're aware, associations typically provide education, networking opportunities, advocacy in Annapolis, and almost all of those things went out the window almost immediately beginning in March and April. And so we had to pivot to meeting the needs of our members and other providers where they were. And that was an extraordinary need for PPE. So our classroom turned from a traditional classroom into a warehouse with lots of PPE and boxes everywhere. And we went about the business of delivering supplies to providers who needed them. We then kind of pivoted to helping with testing resources, with vaccination resources. Woo, it's been a long year for all of us, but pivot is the word that comes to mind for me.
A very important pivot indeed when you think about what your organization was looking to accomplish by doing that. Cathy, do you want to share your word next?
Sure. Good afternoon or good morning, everyone, and it's a pleasure to be here. My word was unprecedented. This is certainly a first in my lifetime to have been faced with a pandemic that was truly life-threatening to everybody, and just the weight of that responsibility, not to mention all of the other real challenges, which was no PPE and were people going to work and how were we going to work. But it was very daunting to have such a life-threatening event be so front and center and to be on the front line in that work. And for us as a hospice in particular, so many people were dying, and they were dying alone, which is so counter to our culture and our work, that there was pain and suffering associated with the inability to do the work the way we've done it previously. And, kind of be in a position where you're underserving the people that you need. So I would say unprecedented. And I think I would also say that we're proud that we, from what our teams did. And I was torn between those two words, but proud is also one that comes to mind. So thank you.
Yeah, two good words, and hopefully unprecedented. And never to be experienced again. But I think we probably all feel at least somewhat more prepared for it going forward. Jason, last but not least, your word to describe this past year.
I've also been thinking about it, and I'm going with the glass half full, and mine is digital. I think you mentioned, Kevin, that there was this huge shift that we had to make, but also there's this feeling of kind of getting pushed forward in technology. For the first time, folks who hadn't experienced, video chatting with their doctors or using, home healthcare techniques. A lot of those things got a real big shift forward. I think that, the things that seemed really far-fetched or that we thought would take a long time in terms of adoption in the technology space has just gone leaps beyond where we thought it would be. And looking to the future, I think our expectations of how we interact with healthcare is just different now because of this very trying year that we've experienced.
I think that's a great word and an interesting one, and it does kind of marry certainly where we've been with where we're going, and that's where I want to pivot next. So if we go back through the same exercise and think about from a forward-looking perspective, we just thought about where we were over the course of last year. And we're going to talk quite a bit about today where we're headed. If you could just describe the future of healthcare in one word, what would that word be? And Jason, I'm going to assume that digital is probably the word that you would choose. But if you have a different one, we can go to it. Otherwise, we can go to the other panelists.
I'm going to say self-service. Can I count that as one word?
Yeah, it's hyphenated.
All right. So self-service would be my word for the future. I'm a huge techie, and I have a lot of different Bluetooth devices that I use for everything from a thermometer to a blood pressure cuff to to my scale that collects data and all puts it into the Apple Health app, and I can send it off to my doctors so that they can see information real time if I want it with certain providers, and I think that is the evolution that we saw coming, but I think that future just got so much closer to us, and I'm still excited to see things like Apple's Health Kit and Google Health and a lot of these things, and how technology is going to help continue to push healthcare forward.
Great. Cathy, would love to get your perspective. One word to describe the future of healthcare.
Yeah, so I chose exhilarating. I think we have come out of this fog, whatever we want to call it, as a much stronger group, and with both consumers, our future patients, and ourselves being much clearer about what we want, what we need, and what we're capable of doing. And I couldn't agree with Jason more. I think technology is going to be at the center of that work. So I'm exhilarated. I think it's one of the most exciting times in healthcare that, and especially here in Maryland. So exhilarating.
That's two glass half full answers, which I love. Rick, what about your word to describe the future of healthcare?
Well, somebody in the chat stole it. It was exciting, but to maybe, and now somebody else, the same person I think stole my next one, patient-centered. But yeah, it was like personalized. It's really kind of like Jason's talking about, having this self-service approaches. People want things on demand. They want it, on their own timeline. They want it personalized for themselves. So yeah, I think patient-centered is a great word, but again, somebody else stole it already. So I'm just kind of repeating what is already in the chat, but I agree wholeheartedly with that sentiment.
We'll still give you credit, Rick. We'll give you that response. And then Kevin, would love to hear your word to describe the future of healthcare.
Nate, I would, and I've been reflecting on this as well. I would use the word boundless. I think, those of us who are in healthcare and have been in healthcare for many, many years are very familiar with the constraints that have existed in healthcare, the silos that have existed. We can't do that because this regulatory pressure, and really an inhibition of free thinking as it relates to what technology can do based upon the constraints that have existed. But I think there have been some silver linings in the pandemic that have created new paths of thinking, some free thinking that I think can be beneficial for us. One example in our space is that heretofore, if you wanted to become certified as a nursing assistant in Maryland, you would have to go to a community college, you'd have to go to a private career school, become certified before you were able to serve. Well, thankfully, based upon the federal government and the state of Maryland reducing some constraints, we had experience for the first time what's called a TNA, a temporary nursing assistant. So people have been able to get into the field to care for others. There was sort of a rush of family members, friends, of people who were in nursing homes and assisted living facilities saying, how can I help? And because of that TNA designation, we were able to get people into the environment helping others and to sort of get them connected to a field that they would have had lots of barriers to get into previously. And so I'm excited about the boundless thought that's taking place and where we're going to go from here. Lots of good possibilities.
And Kevin, one of the things that you just touched on was really some of the certainly innovation, but then also acceleration of, call it trends and developments in the healthcare space. And that's really one of the things that we wanted to dive into today. The phenomenon of healthcare from the home. And that could certainly mean a lot of things to a lot of different people. It could mean new ways of managing chronic disease, a rise in aging in place, rapid advancements in telehealth. And we saw a lot of that kind of accelerate over the course of the last year or so. And I think one of the first questions we want to talk through is how has the COVID-19 healthcare crisis really accelerated some of those trends and changed the face of healthcare generally? And Rick would maybe love to get your thoughts on the matter, and certainly other panelists feel free to jump in.
Yeah, I think from our perspective, the biggest change has been, acceptance, whether it's providers, patients, payers, Medicare for that matter. I mean, technology like no other time was accepted as a use of providing healthcare services. We saw, just this explosion about 12 months ago, 12 to 13 months ago. And, obviously we've seen a bit of a, kind of a cooling off period, but we're still leaps and bounds beyond where we were before the pandemic. And, I think a lot of people really realize that, their fear of technology or their fear of not being able to see their provider in person was overcome by the fact that it's a lot easier, it's a lot quicker, sometimes it's cheaper, and sometimes you just don't need to go through all that process of going to see a provider. It can be done remotely, and that obviously is whether it's primary care or other services. There are a lot of advancements that happen just because people had no other choice than to accept the technology entering their life.
And Cathy, one of the things I'd really love to get your perspective on, just being in the business that Gilchrist is in and providing the services that you provide, thinking about your business model and how Gilchrist reaches its patients and the population that you serve. Maybe talk a little bit about some of the changes that you've experienced and how you've had to pivot and shift, and ultimately how maybe this crisis has impacted your model.
Yeah, thank you. So what we have seen is a dramatic shift. We have historically provided services in any home environment, and so private residences, nursing homes, assisted living facilities, and our own inpatient units. And I would say that the biggest impact that we've seen as a result of COVID is that people do not want to go to buildings. And I apologize to my colleagues on the phone who may be in the nursing home space, but I think we communicated early on in COVID that they were not safe places, and a lot of people went home for care. We have continued to see that trend now that we're out of the immediate crisis. In addition to that, and this was prior to COVID, we had pivoted to providing primary care services in the home. We recognize that prior to someone being hospice eligible, which of course defined as the last 6 months of life, there comes this time period where getting out of the home for services is very, very difficult. Whether that's because you've outlived all of your support system, or you are just suffering from mobility challenges that make it really difficult to go to an office for care. And as we studied those transitions, we noticed that people were beginning to use the emergency department as their primary care location. They would simply call 911. And when we talk to our first responders, they know these people by name and they know how often they call for transport. And so we have essentially built a practice with now approaching 1,000 patients who we're sending physicians, nurse practitioners, social workers, pharmacists, health coaches into the home, and soon to add a behavioral health specialist to round out that care team so that we're bedside. Adding technology to that has just started, and we anticipate that that's going to get better and better and better and easier. And we love the technologies that allow us to not use internet bandwidth necessarily and can run on phone and other simple transmission devices, because the easier we make it, the easier it is to use the service. But we've seen a pretty dramatic shift in our work over the past 4 years. And 88% of us declare that we want to die at home. So I don't see the work changing necessarily back to a lot of facility-based work. I think we're going to see more home care. I hope that answered your question.
Absolutely. And Kevin, I'd love to get your perspective on the question, and I think also your perspective on how do you make this model work? And I would imagine that in your travels over the course of the last year or so, as you've seen a lot of Lifespan's membership base having to respond to this healthcare crisis, you've probably seen some innovation and some changes in models. Maybe talk a little bit about what you've seen and experienced, and some examples of either effective or innovative home health delivery partnerships.
Thanks, Nate. Yeah, sorry, I was on mute. I've been saving for just such this occasion. Now it's on mute. My apologies. So
you're just helping me prove the point that we're live, which is great.
Right. We've seen lots of innovation, and I will tell you that Cathy is very humble, but at the top of the list, I would put some of the things that Gilchrist has done to partner with home care operators and others to do innovative things. I saw a statistic recently that I thought really resonated from a study by a gentleman named William Blair, and that is 81% of physicians responsible for discharge planning now prefer to refer their patients to a home health agency versus a skilled nursing facility. That was 54% before the pandemic. So just in a little over a year, from 54 to 81%. So, we're seeing things move very rapidly into an environment of innovation and partnerships. And we've seen it all over the place. I mentioned Gilchrist and their partnership with Avila Home Care. I know that LifeBridge also has a partnership with Avila, some really innovative things happening. But I would also add that this is the direction that the Department of Health in Maryland is directing that things go. This is not just individual and corporate innovators. It's being led at the state level as well. The state, as many of you know, has a payer system in place that's referred to as total cost of care. But the whole idea of total cost of care, besides saving healthcare dollars, is to get older adults into the least acute care environment possible. Cathy mentioned, the challenges that exist, when older adults are moved from home into a nursing home environment, into an assisted living environment. I think we can all agree intuitively that moving older adults can be problematic. And particularly when you're introducing them to environments with lots of other people coming out of a pandemic versus introducing them to one or just a handful of care providers. So the state is moving things in the direction of home care using technology. They're supporting technological innovation. I'll tell you that the Department of Health is on the record saying Medicaid is increasingly moving away from institutional-based care toward home and community-based services. We all know that. The Department of Aging is also sort of following that lead. Secretary Kramer in Aging said that it's a priority to provide services necessary to allow older adults to age at home and in their community. So, lots of examples of innovative partnerships that have popped up just during the past year between hospice providers, home care providers, skilled nursing operators are now beginning to create their own partnerships with home care agencies, but to do their own, starting new companies that are part of their organization that deliver healthcare at home. I'll just share in closing that had a conversation recently with some state officials around the concept that HSCRC that provides funding, the funding mechanism for care. They're looking at ways to capitate the payment system for nursing homes in Maryland, as opposed to sort of everything beginning with the hospital. And as part of that, they're looking at ways to financially incent nursing homes to do innovative things, to create partnerships, as I mentioned, with other already established home care operators, or to begin their own innovative partnerships and to get paid for that. So, we're certainly moving fast in that direction. And I think I would echo what Cathy says. That's where the future is headed.
Yeah. Kevin, talking about innovators and first movers and people who are kind of first into the space or really, pioneers at innovating and introducing additional services through home health care or having to make a transition. Would love to get the panel's thoughts and perspectives on what are some of the major challenges that those first movers are facing. I don't know if Rick, as you reflect on home health care and some of the trends over the course of the last year and think about those first movers and the challenges that they're experiencing, any thoughts or trends that you're seeing?
Well, I'd say the trend that we're seeing is, and Kevin kind of touched on this, is, how home health and hospice is, looked at by whether it's hospital systems, investors, standalone providers. But the trend that I think we've started to notice probably in the last 6 to 12 months is a lot of interest with hospice and home health by the private equity community. And for better or worse, there's lots of views on, is private equity a good influence or a bad influence in healthcare? But private equity has slowly, over the last 10 years or so, entered into the healthcare market pretty heavily, whether it be through, acquiring behavioral health providers, primary care providers. And now it definitely seems like a new sector of interest to them is home health and hospice. And a lot of what we've been also noticing is that hospital systems are looking at divestiture of those business lines. I think they're looking at how do we kind of frame or kind of refine our business focus into, acute care or things that we're focused on. And, instead of trying to run all things, really focus in on what they're, really good at running. And so we've seen a fair amount of activity and interest by private equity groups, either buying standalone home health or hospice companies or acquiring them directly from a hospital system. And, whether that's, a first mover consideration or not, I guess is somewhat of interest to me. But I think what we're curious to see is if, a national or, even a kind of a multi-state approach from a, provider, management perspective, is that going to create, efficiencies or inefficiencies, or is home health and hospice a type of business that is just too difficult to scale at that level? I mean, obviously that's the move of what a private equity group is trying to do, is try to identify scale in the system and operationalize that. So, that is probably the trend that, as a, accounting, tax, and consulting firm that we're watching as closely as any other, is really the activity of investment within the sector, and why some private equity groups are so attracted to this sector is probably more of our focus than anything else.
Yeah. Cathy, I'd love to get your perspective as someone in the provider space. If you think about the major challenges posed by this migration to home health, and really acceleration that we've had over the course of the last year, what are some of the things that you've been doing to address those concerns, or ways, perhaps surprising ways that you've had to pivot or change your way of thinking and doing things in order to address some of the concerns with that move to home health care?
Yeah, I think for the early adapters, what I would say is you probably have to have some money, because I think we have learned all too often that our reimbursement system always trails innovation. And so and this is no different, in our primary care model, we're being compensated as if we're seeing people in an office, but the windshield time is substantive in home health. And, we really don't see the compensation for the drive time at all. We have integrated technology, and we've done that through remote monitoring and other tools, but they've been through grants, from the HSCRC, because again, the monies aren't necessarily flowing, through our normal reimbursement channels or endorsed reimbursement channels. So I think it's about the organizations that perhaps have some money in the bank. They can afford to make some missteps. And they're willing, they've got boards and other people who are willing to make those things happen. I mean, those were really the ingredients within our organization, because I think the need, the more we build, the more they come. So it's not a matter of whether people want to be cared for at home. It's about how many can you care for at home under the current reimbursement model. So I think value-based purchasing models and hopefully really advocating and seeing more of them. We happen to have our practice in what's called the Maryland Primary Care Program, and because we're seeing largely Medicare beneficiaries, we have done very well with that additional compensation. But I think that's always one of the major challenges when you're innovating, is making sure that the money follows, if not immediately, at some point. And then, having staff. I think that's another real challenge in this post-COVID environment. I think we have all seen that there was a certain portion of our workforces who went home because this was a test beyond what I was willing to find my way through, or there were those real demands of needing to be a parent who was schooling children, and working in home health is really difficult to make that all happen at the same time. So I think also getting our staffs back intact to move this innovation work forward is also a challenge in front of us.
Absolutely. Kevin, any additional thoughts on what we should be doing to address the concerns in home health care and challenges that are being faced?
Yes, I think Rich and Cathy have been right on target. That there are a couple of things that come to mind. Scalability is certainly one. It's inherently, I think, more challenging to provide complex healthcare services one by one versus in a congregate environment. But entrepreneurs are figuring out ways to do it, and technology is a big part of that. I'll just mention, one of the tools that the organizations that we've been familiar with and interacted with, Aging 2.0, is a forum where capital providers are brought together with technological innovators in a multitude of areas, from robotics to data management to sensor technology. And the capitals are set is following. I think I read recently that there are 8 home care operators on the Forbes list this past year. That would have been unheard of even a few short years ago, that many home care companies would be that successful in figuring things out. So certainly scalability is a challenge, but I would also echo what Cathy said. Staffing is a major issue, and this is another area where technology is coming to the rescue. Technology that helps operators, whether it be hospice, home care, or other home and community-based services, being able to deploy scarce nursing resources in the very most effective way. What's the best way, to get from point A to point B to point C in the most effective way? What's the best way to employ the staffing resources that you have, whether they are full-time, part-time, PRN, or otherwise, into the places that they're needed most effectively? So, in both areas, I'd say technology is really at the head of the line in terms of solving some of the challenges related to the most efficient ways to provide care remotely and otherwise, and the most effective way to deploy very limited resources.
Yeah, as you reflect on the past year, I think it was my good friend, Mr. John Rainey, who mentioned in the chat box that necessity is truly the driver of innovation. And Kevin, you talked a lot about technology and technology's role in innovation in home health. Jason, would love to get your perspective on, if you think about home health care, being proactive and providing ongoing care is of the utmost importance. Maybe talk to us a little bit about your viewpoint on the role that technology plays in providing that care.
Sure. So I think that home healthcare is going to see the most innovation by following, companies like FedEx, looking at logistics. One of the most important things, I think you said it, Cathy, is that windshield time and being able to use information about patients to actually look at the ideal pathing. How do I get, the most out of each of these, nurses or doctors that are on the road, and really looking at the benefits that come from that. I think on top of that, there's also the questions of scalability. What we're seeing and what we've continued to see is Amazon's push into the pharmacy market. In the case of my parents, I don't want them going into buildings, and while they're receiving services that are home healthcare services, they've also moved to receiving their drugs by mail and, and using a telepresence, device or something for certain types of treatments. The other thing that I think is really interesting is the place that artificial intelligence plays in this. That the more we build up the profile and the more that we know about our customers, the more we can use that information to start to prescribe certain solutions or make decisions on the type of person that should be going on a visit as a home healthcare provider. So I think there's a lot of innovation that still can happen behind the scenes that will allow these service providers to scale to a level that that's just becoming possible now.
And Cathy, here's another question that I'd really love to get your perspective on. If you think about the role that technology plays in kind of advancing the ball in home health care and what the future may hold, what's your viewpoint on the role of technology and really making this either more of an accessible model, home health care in general, or a more effective model? And Cathy, you're on mute.
Thank you. And I was getting such a head of steam on that too. I think for us, it's no longer a question of whether we will. It's about when and what those technologies will be. Like, we've clearly pivoted into technology is going to be part of our solution moving forward. And I also believe, let me just say it again, I believe that home will be the future of where most care is being provided. So, you know, for us, we've had to really learn about technology. I mean, let me just start there. Like, you know, when you say the word technology, like, what does that even mean? So we are at least at the point where, you know, we understand the difference between active and passive technologies, right? And active technologies are where the user has to be engaged and trained to do that work. There are certain patient populations where you can't be engaged in that work, and you need passive technologies to do that work for you that are, you know, and they are things like cameras and bed sensors, right? Like, who would know that we can literally monitor the number of times that somebody gets out of their bed and for how long they're out, so that we can help them in the morning to understand why they're getting up in the night, which puts them at risk for falls and other things, so that we can keep them safer. And no doubt these passive technologies are going to be critical for the dementia patients and other neurologic disorders, and alarms for safety and technologies for tracking visitors, right? I think we've also learned during this pandemic that the lack of socialization, we have found that people have they've lost their hearing, right? Your hearing is controlled by a muscle, and when you don't use it because people aren't talking to you and aren't visiting you, we've seen a decline in people's hearing. So reading to yourself has become an intervention for returning that kind of work. So those are simple tools that we didn't know 12 months ago, and we're going to keep learning about that. Kevin, I think you mentioned the use of telehealth to extend kind of your labor pool, right? Integrating physical visits along with telehealth visits just allows you to do more work. We are also introducing that telehealth technology after hours, which is when people are most vulnerable and most likely to call an emergency room because they're not feeling like they're getting the intervention. When I can see you and talk to you, that's a different interaction than when I'm simply on the phone. And we're finding that very effective for not only triaging and reducing readmissions, but also incredibly effective in mental health interventions. You know, what's been so surprising to us is that that screen almost makes you feel like you're in a different kind of privacy than you are when you're sitting in front of someone. And again, for the older population who's isolated, the amount of depression that we've seen during the pandemic has been substantive. Remote patient monitoring for vital medical statistics. I mean, I think that's the technology that we're all most familiar with, but learning about these other ones is critical. And we partnered with a nursing home who had nurses 24 hours a day to do our telehealth work. So our primary care practice is linked with a nursing home who is providing the nursing triage work overnight for us. So that's just an example of pivoting outside of our own space. They were already there. They already had a call center, and we just purchased services from them rather than recreating it. You know, I believe, and Jason, this is coming your way, so I hope you'll, you know, help us with this, but I think we're going to see robots who are going to be cooking and cleaning and taking care of people moving forward. There are not enough caregivers in the world today. And so if we can find ways to do that, now that's kind of my, you know, and then I would love to see nursing homes providing care at night, because the reason that people often go to facilities is I think we need to flip-flop the adult daycare and have it be adult night care, because for working caregivers, they need to get sleep. And we probably need to reverse all of that work. So And social determinants of health are key. And I think we're going to see ourselves partnering with Meals on Wheels, other kinds of organizations to help us do our work. It's no longer going to be enough for us to take care of the medical issues. We're going to need to take care of that patient holistically in ways that we haven't done in the home before. So that's kind of how I see the use of technology moving forward. And again, I think it's just a phenomenal time to be doing this work.
Cathy, just because you mentioned robots, I think we have to look to Asia, in a lot of times, because that's what they're dealing with. This is a growing older population that doesn't have as many caregivers, and they're very much looking to robots and looking for solutions that will allow for meal prep and a lot of these different things in their older age. And I think that you can really see what that future looks like there.
Well, Jason, I'm depending on you to get it in place by the time I get there, please.
I'll get working on it.
No pressure, Jason. Well, I think one last question that had been prepared, and then we're going to shift to the audience's Q&A, because we have had a couple of questions come in. I'd love to tack on to that last question, and we were talking a little bit about the role of technology in making care more accessible and effective, but health equity is another really just key component of healthcare. And Rick, would love to get your perspective on what role technology plays in ensuring that there is equitable access to good care from the home.
Yeah, I think we have a group of individuals that we're working with that is working on a project right now trying to identify equitable ways of delivering telehealth. And I think when we talk with them, I think for a lot of us, we just make certain assumptions. We make assumptions that people have internet access or that they have devices, and obviously that assumption is flawed in many ways. Many people don't have great internet accessibility, don't have devices, or can't use them because of other reasons. And, I think when we peel back that onion a bit and understand that, there are individuals that are going to have complications of using those kind of devices and figuring out how to get there with them. And I think, Cathy, you brought up a few different areas that really hit home with me. Active versus passive technologies being one of them. Technologies that can use even just cellular data versus, high-speed internet data, and where that goes. And one of the things that I think, we're very curious to see, and, from a legislative perspective, I'd say, one of the things that we've been tracking is, when it comes to the infrastructure package that, President Biden has talked about, how much of that might be part of the solution, how much of that could be a 5G technology grid that would be accessible to more people, or could be, a different answer to that question, or at least part of that question. So, for us, I think, one thing we commonly hear as we talk about telemedicine, and especially because, surprisingly enough, our firm has a lot of clients that are in the rural markets. And I think when we talk to them about telemedicine and virtual healthcare, especially before the pandemic, the first thing that always came up was, 25% of the population that we serve doesn't have high-speed internet. And I think, we need to, as a country, probably figure that answer out. Otherwise, the scale and the access of being able to use technology to answer some of these problems only answers the problems for the people that are lucky enough to have access to the high-speed internet that they need to do the things that they're trying to implement. So, I think obviously this is a very large problem for our society to answer, but I do think it's part of the solution. Maybe a really, really accessible 5G network that can run high-speed, types of device, or high-speed types of, technologies over a, more of a cellular-based network. So that's probably the thing that I think we're the most hopeful for.
Great. All right. Well, we as promised, do want to leave a little bit of time to answer some of the questions from the audience. And the first one, so I think, the whole topic of mental and behavioral health clearly struck a chord with our audience. And that has been something that's been in the forefront of the discussion across the nation as it relates to healthcare. So the question here, Cathy mentioned adding a behavioral health specialist to the Gilchrist team. And the question here is, what source of useful data or technology are available to help providers actually capture, digest, and plan for doing more than just providing generalized behavioral health services, but actually providing services based on identified needs, i.e. data of their client base? So I don't know if any of our panelists are brave enough to step into that, or Cathy, if you have a perspective on that.
I have a couple. One is we screen 100% of our patients for social determinants of health. And we can mine all of that data by race, by age, by location. And that's what guides our partnership strategy of sorts, like who do we need to be really working with. The other thing is that we use, and I may mess these up, so if there are behavioral health specialists on the line, I apologize, but I think it's a PQH9 and a GAD7, which assess depression and anxiety. And again, all of our practice patients are screened. I mean, it's an optional tool, like we can't make you fill out a questionnaire, but just like you would fill out your propensity for diabetes, or whether you're perhaps drinking a little more than you should, these are tools that would guide the level of depression and anxiety. And again, so we know what those rates are within our patient population and whether our behavioral health interventions are decreasing those scores, which is a positive thing, and the number of transfers. We find that the CRISP network, like what a remarkable tool here in Maryland that doesn't exist in other parts of the country, that allows those scores to be stored and mined. And we have to be careful, of course, with the behavioral health data because it's protected in ways that our physical health data isn't quite protected quite as much. But I hope that answers the question. That's part of what we do.
Great. Thanks, Cathy. We just had one question come in specifically for Jason. And the question is, do you see the new Starlink satellite system improving internet coverage for rural home healthcare companies and their consumers?
I definitely do. We actually have a few Mindgrubbers who are in rural parts of the country, some in the Midwest. And, Starlink is, for them, looks like it's going to be one of the best options they have as they continue to do the remote work Zoom calls and look for options. So I'm super excited about it. On that same note, when you were talking, Rich, about, the technology and equitable technology, one of the things that, that's come to mind is this idea of a world where you essentially have to have a cell phone, or you have to have an email address to do business with with anyone. There is a great piece, and I can't think of what publication is in, on a world where you have to use Uber and Lyft, where there's no taxis. This idea that you can't pick up a phone and call someone to pick you up. You have to have a device to interact. So.
Great. Thanks, Jason. I think probably the last question that we're going to have time for, it just came in as well, and it's really around the provider and payer model. And the question is, do you think the near future holds a more brisk step to encourage providers to move into a provider payer model? So the example is given here, more like PACE or hospice and palliative care. The models where the provider and payer are the same organization. I don't know if Rick or Kevin, if you have any thoughts on that.
Sure. I think overall the entire healthcare ecosystem is moving, closer to, more of a vertically aligned system. You see, all types of acquisitions and mergers and activity within that space. I think if you track Optum and their acquisition of physician practices over the last, 5 to 10 years, you'll see that they've quickly become the largest employer of physicians in the United States. And I think, you'll see other, payers continue that trend. In the Midwest, I'm from Minnesota, and, Wisconsin has long been a very provider-based plan provider-sponsored plan state. A lot of the health plans in that state are owned by providers. And I think, when we look at that model, it's very interesting to see, how that's worked, from a capitation perspective and, from a healthcare perspective. So, I do think that model will continue to extend through other sectors within healthcare beyond just acute care. And I think, that model definitely creates a more aligned, or has the opportunity, I shouldn't say it automatically, it's not an automatic, but it has the opportunity to create better alignment of incentives. So I think it could make sense, given the right infrastructure that is created to kind of take those incentives and make sure that they're aligned correctly.
Great. Kevin, any thoughts from you on the question?
I'm going to give my shortest answer of the day. I agree with everything that Rich just said. He's 100% on target.
Great. All right. Well, that just about wraps up our Q&A time. So I wanted to just say thank you again to the members of the audience who asked the questions to our panelists, and thank you, panelists, for sharing your insights. So we appreciate everybody joining us today to talk about one of our favorite topics. And thank you again to each of the panelists for being generous with your time. Here is our information just one more time. We encourage you to certainly stay connected with Mindgrub and check out what's new at RSM, Lifespan, and Gilchrist. And for those of you who did attend, we will be sending out a recording of today's session to all the registered attendees. So do keep an eye out for that in your inbox sometime early next week. And just wanted to take one last opportunity to thank our panelists and thank all of you for joining us today. And I hope you have a great afternoon. Take care.